It is 3 in the morning, and your smartwatch suddenly buzzes against your wrist. You wake up, check the screen, and see a red notification warning you that your heart rate dropped severely while you were asleep. You are immediately faced with a choice. You have to figure out if that low number means you are achieving elite, healthy deep sleep, or if your heart is actually experiencing a dangerous malfunction. The human heart does not simply turn off or enter a uniform state of rest the moment you close your eyes. It goes through complex electrical and physical shifts throughout the night. To make sense of your data, we have to separate the benign, physiological heart rate pauses from dangerous, pathological arrhythmias. Ignoring these nighttime signals or misinterpreting them can have severe consequences for your long-term health, increasing your risk of sudden cardiac events. Understanding exactly what your sleep data is trying to tell you is the critical first step. We can transform that 3 a.m. anxiety into actionable awareness. The confusion usually starts with a foundational myth, the idea that sleep is exclusively a period of neurological recovery and full-body relaxation. This comparison table shows the medical reality. On the left is the myth of pure neurological rest. On the right, we see that sleep is actually a highly dynamic period of cardiovascular regulation and shifting autonomic balance. Because of this active regulation, we often see sleep-related cardiac arrhythmias. These are abnormal heart rhythms or sharp changes in heart rate that are directly linked to specific sleep stages or breathing disorders. Holding on to the myth that sleep is just pure rest causes patients to completely miss the early warning signs of dangerous conditions like atrial fibrillation. Once you treat sleep as a nightly cardiovascular stress test, it changes exactly how you evaluate morning symptoms. Symptoms like racing palpitations, unexpected morning dizziness, and severe breathlessness. To evaluate your heart's baseline, we can look at this quadrant chart. It maps the 2 primary phases of your sleep cycle on the x-axis against your autonomic activity on the y-axis. First is NREM, or deep sleep. Here, your parasympathetic nervous system takes complete control of your body. During this phase, your heart rate naturally slows, blood pressure drops, and you may experience benign pauses. This bradycardia signifies healthy recovery. But shifting into REM sleep, your autonomic nervous system becomes unstable. It fires sudden sympathetic fight-or-flight bursts. This REM instability naturally increases your heart rate variability. For brief periods, it makes the heart temporarily more vulnerable to fast, irregular rhythms. These shifts between slow bradycardia and sudden REM spikes are expected, healthy features of human sleep architecture. Seeing a fluctuating heart rate on a smartwatch in the morning is often just a reflection of your body cycling through normal sleep stages. The calculation changes when we introduce the primary pathological disruptor, obstructive sleep apnea, or OSA. This graph maps the exact physical mechanics of an OSA event. You can see the top line flatline as the sleeper's airway collapses. Immediately, blood oxygen drops steeply, while carbon dioxide levels rise. As the sleeper struggles against that closed airway, severe pressure changes physically stress the heart muscle. The heart rate plummets concurrently with the oxygen drop. The dangerous climax occurs when the oxygen-starved brain recognizes the threat. It triggers a violent, sudden gasp, yanking the body out of deep rest. This violent arousal causes a sudden adrenaline surge. Your sympathetic nervous system floods the body, instantly skyrocketing the heart rate into tachycardia. Going through this repetitive process dozens of times an hour creates severe inflammation and mechanical wear and tear on the cardiac tissue. This violent autonomic swing from oxygen starvation to an adrenaline-fueled racing heart actively destroys cardiovascular health. This repetitive cycle of hypoxia and adrenaline surges creates an electrical storm within the heart's conduction system. That storm triggers specific dangerous arrhythmias. The most common are atrial fibrillation, prolonged sinus pauses, and premature ventricular contractions. While normal NREM pauses are part of healthy recovery, these specific arrhythmias indicate a heart struggling under severe physical duress. Symptomatic patients might not even realize they stopped breathing. Instead, they feel the cardiac aftermath, waking up with a racing heart, profound shortness of breath, or unexplained chest discomfort. For an individual with untreated severe sleep apnea, the bedroom transforms from a sanctuary of rest into a high-risk environment for sudden cardiac events. This flowchart provides an action plan to evaluate your nocturnal data. Starting at the top with your symptom type, we can trace whether you need to seek medical intervention. If your heart rate drops or pauses for under 3 seconds during deep sleep and you experience no other symptoms, you are in the safe zone. This is generally benign and requires no intervention. The definitive red flags are frequent pauses lasting over 3 seconds, sustained fast rhythms, waking up gasping, or experiencing daytime fainting. These branch directly into a medical escalation. Your cardiologist or sleep specialist will escalate the evaluation using diagnostic tools like polysomnography, commonly known as a sleep study, alongside wearable Holter monitors. These tools provide undeniable proof by directly correlating abnormal electrical heart events with specific sleep phases and exact oxygen drops. Securing objective clinical data is the only reliable way to separate harmless physiological quirks from lethal risks. It moves you out of anxiety and straight into targeted treatment. If you are diagnosed with OSA-driven arrhythmias, the absolute gold standard intervention is continuous positive airway pressure, or CPAP therapy. There is often reluctance here. Adjusting to wearing a CPAP mask every night represents a frustrating and uncomfortable daily lifestyle friction, but the physiological return on investment is immediate. The CPAP physically holds the airway open, entirely eliminating the hypoxia and preventing the ensuing electrical storms from ever starting. Treating the root cause with CPAP is often more effective at reducing your actual arrhythmia burden than taking dedicated heart medications. The final outcome is restored autonomic balance, steady breathing, and a protected heart that can sleep safely without the stress of oxygen starvation. If you have sleep apnea, a CPAP machine provides essential cardiovascular life support, shielding the heart from sudden failure.